Hi friends, today in our podcast series from CSI West Bengal branch, I am being joined by Dr. Soumya Kanti, who is an iconic figure in the interventional cardiology field working as senior consultant in AMRI Manipur group of hospitals. So Soumya, if we talk about pacemaker and loss of consciousness, what is a pacemaker for a physician, for a common people?
So pacemaker is a kind of device that prevents us from syncope. What Sarah has already told, that loss of consciousness. This is a tragic thing. Many of the patients come with the loss of consciousness or even syncope that very frequent manners. So the pacemaker we put in those patients who are having several indications like sinus pauses, like any kind of block, obviously electrical blockage within the heart that is diagnosed through ECGs or Holter monitoring. And the most important thing, we can give them a normal life after the pacemaker. That is, often the patients often regrets that, yes, I have a pacemaker, I can't live my normal life. But this is absolutely wrong. Any patients after having a pacemaker may lead his normal life forever.
Is it very scary surgery?
Not at all. This is a almost half an hour surgery. We all are doing it effortlessly. And the most important thing, we can save their lives also, as well as give them a new life forever.
So it is a device which can be done through an incisions on somebody's chest, and you know that it could be either a wireless pacemaker or conventional pacemaker. Wireless pacemaker is a tiny pacemaker, but you know that all work for at least 10, 12, 15 years in patient's life. So what type of pacemaker you advocate for all age groups?
Generally dual chamber pacemakers, obviously, and MRI compatible pacemakers, because even if we put a pacemaker, the person or the patient may need doing MRI in near future. That means he may have a brain stroke, he may have an orthopedic surgeries as well. MRI of the brain or before any orthopedic surgeries, MRI is very commonly done. So we may shift to the MRI mode before any procedures or surgical procedures. That is an important thing that generally we promote for a dual chamber MRI pacemakers nowadays.
Right. So many people have a lot of apprehensions or misinformations regarding a modern generation pacemaker, like they cannot touch the electric switch, they cannot go through the airport metal detections or any other high frequency voltage. So what's your take on that? I mean, is it very safe for the newer generation pacemaker to go through normal day-to-day life, or there are some restrictions?
So these thoughts are absolutely wrong. The persons, even after implantation of the pacemakers, may touch the electric board, may use their mobile phones as well. And if they have a pacemaker identity card, they may reach the airports where the metal detectors are widely used. So what I tell, even after my every procedure of pacemakers, that please lead a normal life without a stress-free. Definitely you are having a normal life as before. The only thing that pacemaker gives you is a new birth.
Right. So there are there are newer pacemaker which can increase the pumping function of the heart, like failing heart. It can give shocks if your heart rate goes very fast or your pumping goes down. So what are these type of pacemakers?
Sir, so these are absolutely normal nowadays that we are implanting a CRTs, that is a cardiac resynchronization therapies. There are various devices, also not only the normal CRT-P, that is the pacing systems, we are having the CRT-D, that with a defibrillator device. And the most important thing that Sir has already told, that it may increase, obviously with the help of the drugs, your ejection fractions. Suppose a patient comes to me with an ejection fraction of less than 40 or even less than 30, we are nowadays doing with a CRT devices with a conduction system pacing. So what is that? That is that we are re-implanting your normal sinus rhythm when your heart is diseased, when your heart is not pumping properly. You may have, obviously with the support of other drugs like ARNI and beta blockers, and obviously the mineralocorticoid antagonists, these are the normal drugs that often we prescribe. But pacemaker facilitates to improve your ejection fraction, and when you are having the improvement in the ejection fraction, the quality of life improvement is there, and you may lead a normal life what you were not having previously.
Okay, there is another aspect of pacemaker malfunction. No? The patient often asks, how would I get to know that pacemaker which you have put in my body is not working or it's not functioning as it is supposed to do. So what are the methods of monitoring this pacemaker at home or by the physicians in their clinics?
Yes, this is an important question because many of my patients often comes to me that my pulse oximeter is showing low pulse rate. That is, they often check after the post-COVID era, almost every home is having a pulse oximeter. So if the patient is having recurrent symptoms again like pre-syncope or syncope, and the most important thing is the pulse oximeter is showing low pulse rate, you can monitor it at your home, that is less than 50. If you are having after implantation of the pacemaker, do consult your physician or a cardiologist and immediately you do an ECG with a, obviously in post-pacemaker patients we do with a magnet in place. But we can detect almost 90% of the pacemaker malfunctions just by doing an ECG. Obviously with a magnet, the sensing and pacing of the pacemaker can be diagnosed. And even if you are having the symptoms, you may contact your physician or a cardiologist, and the programming of the pacemaker will give you a detailed data that even if your pacemaker is doing well, you may have other symptoms like tachycardia also. So the syncope may not be because of the bradyarrhythmias or the low pulse rate. You may have a tachyarrhythmias, you may have a paroxysmal atrial fibrillation, that is the abnormal irregular heartbeats because of several causes. That may be because of the coronary artery disease, that may be because of the viral infections too. So this may give you a similar episodes just the pacemaker was implanted before. So don't get scared. If you are having a symptom, do immediately contact your physician or a cardiologist. They will give you a proper guidance. And pacemaker malfunctions are not common, but they do occur and it is also treatable. So don't be scared even if your pacemaker is not functioning, but the immediate thing is that you should consult with a cardiologist, and the most important thing, the pacemaker programming is needed by the company fellow people.
Right. So there are situations where your pacemaker ends. That means end of life, the battery has to be replaced.
Yes.
And there is an apprehension whether it can be done externally, internally. Can you explain to the audience how this end of life happens, why it happens, and how it is tackled?
Yeah, the end of life means the pacemaker battery is not functioning or going to end within 3 months or 1 month. So we can detect it just like a simple pacemaker programming. And the most important thing, the replacement of these pulse generators or the batteries is so simple that only a 10 to 15 minute surgery is sufficient enough. It is not at all painful, and you may have your previous life as before. So pacemaker programming as well as the pacemaker pulse generator replacement, you should not be scared of that. Normally these days the recent pacemakers run for at least 12 to 15 years, and they will give you a normal healthy life forever.
Right. So, and for the people, elderly or young, even child can get a pacemaker.
Yes.
If they have other diseases, they should continue other medications like pressure medicine, the cholesterol medicine, the vaccinations. All these medicines should be taken as it is throughout their life. Now, in your practice, I think how many people who believes that once the pacemaker is given to your body, you are not going to suffer from heart attack or any other strokes. So there is another misconceptions or myths that pacemaker gives a protection for life. Is it true?
So the thing is that the misconception that a pacemaker will prevent you from heart attack is not at all, because through pacemakers we prevent you from electrical abnormalities of the heart, not through the blood channels. That means the arteries, coronary arteries are not protected by the pacemakers. We can put a pacemaker before heart attack, we can put a pacemaker even after the heart attack. Many conditions, this is absolutely indications. So the simple placement of a pacemaker will not prevent you from heart attacks, not will prevent you from the coronary artery disease. You may lead a normal life, but the chances of heart attacks will be there. And if you are having symptoms like chest pain, like heaviness of your chest, or any other symptoms like sweating, please do consult your cardiologist, because the ECG may be misleading. When a patient is having a pacemaker already implanted, the diagnosis of heart attack becomes difficult through the ECGs. Echocardiography will give you a different manners of diagnosing of recent heart attacks after the implantation of the pacemakers. But definitely, if the symptoms of chest pain, dizzy spells, sweating, pain referred to the arm or jaw, definitely you should consult a physician or a cardiologist to prevent you from further coronary artery related disease, because pacemakers will not protect you from coronary artery disease.
Right. So that means pacemaker is not a guarantee that you are not going to die from other causes.
Yes.
Or a cancer or a heart attack. So pacemaker is for your electrical problem. And usually this pacemaker, we have seen our teachers during our student days, they used to stay here, get infected. They stay in the hospital after pacemaker infection for 7 days, 5 days. Nowadays, how long the stay of a patient, average stay of a patient in the hospital? So how long, how fast a person who is having a conventional pacemaker, not about wireless pacemaker, can go back to his day-to-day life? How early they are discharged?
Yes, so they are getting discharged even in the second day or the third day. I generally prefer to discharge after second day, because these implantation procedures are so simple that it is almost painless. Through the local anesthesia it's being done, no usage of general or spinal anesthesia. So the pacemaker implantation, the patient becomes ambulatory from the very next day, and they may leave home even the second or third day and will lead the normal life. After 7 days, what I think that they should be ambulatory as early as possible and to lead their normal life as early as possible for throughout of their life.
Right. So you are trying to give a message to the community and the society at large that pacemaker is very safe procedure. It's a life-saving procedure. It is magnetic or non-magnetic varieties is not a concern. Airport is not a concern. And next day they can go home. Now, is there any negative side of having a pacemaker who really needs it? So people ask that I may not be able to work normally, like I am crippled or disabled by a pacemaker. Is it so?
So it is absolutely wrong. After implantation of the pacemakers, you may have a normal feeling of your just wristwatch. So the pacemakers are implanted either from the left or right side. So you may have a feeling of having a just 10 rupees coin in your pocket, and otherwise you will have a normal life. It will not disturb your day-to-day activities at all.
Right. So we are almost coming to the end of our discussion, friends. And size does matter. The recent pacemakers are getting smaller and smaller. There will be, as I said, much smaller pacemaker with your nuclear battery or newer technology. Till that time, we have to be very happy with the available existing pacemaker. And some pacemaker can cause some infections. So is it really scaring the infection in many patients' life? Once they get infections, was discharged from the pacemaker, it has to be replaced by another pacemaker, removing all the leads inside, otherwise it could be life-threatening. The chance of infection is very low, and we still do not know why people get infection. So where the pacemaker should be done, in which type of hospital the pacemaker should be done to avoid infections?
So definitely pacemaker infection is a horrible situation. So often we have to change the pacemakers from other side or other pockets. But the thing is that we can prevent several preventive necessary measures. Is that the centers where the pacemakers volumes are largely being widely used, that should be done in a quite sterile manner. And even after the discharge, generally we recommend our patients that you should wear proper healthy cleaned clothes. You should not touch the pacemaker wound. And the most important thing, the appropriateness of the antibiotics. You should continue for the total course of your antibiotic. And the worst thing is that even after taking the appropriate measures, also the pacemaker's pockets getting infected because of several reasons. There are several preventive measures as well. But after that, even the pacemaker's pocket is getting infected, we have to change not only the pocket infection, the lead vegetations or the lead that is implanted in your heart may get infected also. So these things are horrible situations. This may be life-threatening also. This may lead you to have chronic antibiotic consumption as well for prolonged period. But everything, it is treatable, and in dual pocket infections also now we are being implanted with a leadless pacemakers. What Sir was telling, that both side infections we have found, and in those patients who can afford definitely the leadless pacemakers, that is there is no lead at all, we can simply put from the groin just like a temporary pacemaker, and will release your pacemaker batteries within your heart, and it is absolutely life-saving. Without any incision, without any complications, you can have your normal life.
Right. So thank you, Soumya. And this pacemaker is so simple nowadays. And West Bengal or Calcutta is the hub of pacemaker. In India, the number of pacemaker implantation is highest, and we have the highest experience. And he is very prolific performer and very elegant operator doing a pacemaker, very simple way without much complication, I would say less than 1%. So I hope you have enjoyed our program today. And if you like this, please subscribe to our channel. Thank you. That's all from CSI West Bengal branch. Me and my friend Dr. Kanti signs off. Thank you.